Bunları geçmiyor.
Kebetulan
أقول إنه فلان أقول إنه Yeah, excuse me, sir. Excuse me, sir. There's a camera just taken.
Ladies and gentlemen, can I please ask you to take your seats? Welcome, honored members of the media, Excellency Secretary General Ban Ki-moon, Excellency Dreyfus, former President of Switzerland and the co-chair of the Secretary General's high-level panel on access to medicines, Honorable Director General of Health, Precious Matsoso, also a member of the Secretary General's high-level panel, and Lorena DiGiano, who is the director of an important network of people living with HIV in Latin America, who is a member of the expert advisory group that is advising the Secretary General's high-level panel. We are gathered here today to provide a briefing on the progress that has been made by the high-level panel on access to medicines. And we will have a series of remarks and then we'll throw open the floor to members of the media community to ask any questions. So it is my great pleasure to introduce my boss, His Excellency Secretary General Ban Ki-moon of the United Nations. He will be making some introductory remarks and then we'll hear from the co-chair and the panel members. Thank you.
Thank you, Moderator Manjit Taniwal. Good morning, ladies and gentlemen of the media, Excellencies, and Mr. Shedibe, Executive Director of UNAIDS, Madam Ruth Dreyfus, co-chair of the high-level panel, former President of Swiss Federation, Ms. Malibona Precious Matsoso, member of the high-level panel and Director General of Health Department of South Africa, Ms. Lorena DiGiano, member of the high-level panel's expert advisory group, distinguished panel members, and ladies and gentlemen. Thank you for your participation and strong commitment and interest in fighting the HIV/AIDS together with the United Nations. Since today is Nelson Mandela International Day, I want to draw on his wisdom. Madiba once pointed out that while the AIDS epidemic threatens the fabric of our lives, more money is spent on weapons than on helping people infected by HIV. And he added that, I quote, overcoming poverty is not a gesture of charity. It's an act of justice. Unquote. 16 years ago, when the AIDS conference was last held in Durban, less than 1% of all people living with HIV in poorer countries had access to treatment. Millions died waiting for medicines. Today, more than 17 million people receive treatment. We can thank many partners for this success. First, people living with HIV. They are a vivid reminder that health is a fundamental right. Second, biomedical companies. They produce the medicines that are more effective and less toxic. And we now can diagnose people in 20 minutes or less. Third, generic medicines. They transform the AIDS response by cutting costs to just $1 per day. That brought treatment to millions of people. Fourth, international finance. Countries came forward with the funding, like PEPFAR, the United States President's Emergency Plan for AIDS relief. Many donor countries have supported the global funds to fight AIDS, tuberculosis, and malaria. The world has proven that when we come together, we can transform lives. But the gains are inadequate and fragile. More than half of all people living with HIV still lack access to treatment. Many people cannot afford a new generation of treatments for AIDS, hepatitis C, and other non-communicable diseases like cancer. There is not enough research and development on neglected and rare diseases. Tuberculosis is the leading cause of death for people living with HIV. But there have been almost no new medicines to treat it in years. The bigger health picture is worrying. We are reactively addressing threats like Ebola and Zika. Antimicrobial resistance is a major threat that could kill as many as 10 million people a year by 2050 if we fail to act. The world has a blueprint for a better future. The 2030 Sustainable Development Goals are our ambitious and achievable vision of a life of dignity for all people. If we want to provide universal health coverage by 2030, we have to break down barriers to treatment. And we need to develop treatments for tuberculosis, neglected tropical diseases, and other unmet needs. I established the high-level panel on access to medicines to address these issues. I have asked it to make recommendations for a coherent set of policies that addresses the rights of inventors, international human rights law, trade rules, and public health. I thank former Presidents Madame Ruth Dreifuss of Switzerland and Festus Moe of Botswana for their leadership. I am confident that the 16 panel members will bring their best energy and expertise to this complex and sensitive task. I look forward to their report. These recommendations can affect millions of people. When we give them the best possible global response to AIDS, they will help build our common future. Thank you.
Thank you, Secretary General, for those inspiring remarks. It's now my pleasure to hand over to Madame Ruth Dreifuss, who is the co-chair of the high-level panel and the former president of the Swiss Federation. Madame Dreifuss.
Thank you so much. Good morning, ladies and gentlemen, Minister, Director General, and Mr. Secretary General. Let me express first my grateful for your leadership and for your strong will to promote medical innovation and access to medicines, vaccines, diagnostic and medical devices to all in need. I am also grateful and express this gratefulness in the name of the members of the high-level panel for the trust you placed on us, on this group of 16 persons who showed all, and I am very grateful for my fellows, an exceptional commitment and a readiness to mutual understanding. Before co-chairing the high-level panel, I had the honor to chair the Commission on Intellectual Property, Innovation and Public Health. Our report was addressed 10 years ago to the World Health Assembly, the first step towards the adoption of the WHO Plan of Action, and other initiatives followed, either on international political level or in practical solutions, often in form of public-private partnerships. Today, a renewed momentum is clearly both necessary and growing. First, the Sustainable Development Goals for 2030, with the special goals in the field of health and in the field of the benefits for all of scientific progress. Secondly, the biomedical innovation landscape has changed in the last 10 years. On one side, we witness a new period of very fruitful inventions, but the prices of the new medicines for cancer, for hepatitis C, to take the two examples, make them unaffordable for the largest majority, paying them out of the pocket. But not only them, and not only in the least developed and low-income countries, even in high-income countries, the universal coverage system is no longer able to guarantee to certain very expensive therapies. The lack of transparency of the innovation sector makes it difficult to know what these high prices are rewarding: research and development, or the profit of the investors under the protection of IP rights. Secondly, in this new landscape, for some rare diseases, for neglected emerging diseases, for addressing the challenge of antimicrobial resistance, the innovation is not incentivized by the IP rewarding system. To complement it, it is of utmost importance to develop new incentives. Third, the development of the global trade and the multiplication of free trade agreements have fragilized the flexibilities of the trade-related intellectual property rights agreement in order to protect the rights to health. We have to find a new equilibrium, a new balance between these rights and right to health. Fourth, a coherent and comprehensive approach of trade, intellectual property, public health, and human rights needs to be streamlined and coordinated at the highest level of decision, on the level of national governments and on the level of the international governmental organization. And it needs the collaboration of all stakeholders to build about existing models of successful partnership. What we have learned through the fight against HIV/AIDS has to be expanded to the whole sector of biomedical innovation and access. Thank you for your attention.
Thank you. Setting out the context under which the high-level panel is working. It's now my pleasure to hand the microphone to Madame Precious Mutsoso, a member of the high-level panel and Director General of the Department of Health in South Africa.
Thank you, Secretary General Michelle Sidibe, Minister of Health, and good morning 1 year after the AIDS conference, the Doha Declaration was adopted. It stated that in terms of the TRIPS agreement, countries should make full use of TRIPS flexibilities. The TRIPS agreement, in terms of the Doha agreement, that was declaration that was adopted, states that the agreement, the TRIPS agreement, does not and should not prevent members from taking measures to protect public health. We saw 3 years later the creation of initiatives to fund HIV, AIDS, TB, and malaria. The creation of the Global Fund, PEPFAR, WHO pre-qualification to facilitate access to generic medicines, Clinton Health Access Initiative, which was also instrumental in negotiating prices, and a whole lot of other initiatives. But we also saw in 2006 the creation of Unity, which was meant to also facilitate access. The creation of a number of countries, including Brazil, Chile, France, Norway, UK, as an innovative approach to health financing. But as we focus on sustainable development goals, we need to understand that there are still barriers to access which are still not addressed. But that we have to establish whether is the glass half full or is the glass half empty. In saying that it's half full, it means yes, a lot has been done, but more still needs to be done. MTR and SRCB require new products, and that means that we need investment in research and development. Pediatric formulations for children must be developed. It means that we have to look at smaller, very useful formulations for children because children are not young adults. But we also saw the devastation in West Africa of Ebola. The vaccine that had been developed in Mozambique. And Morrison disease. So in essence, it means that there must be a mechanism by which we develop drugs, and there is funding, there is some coordinating mechanism. And that also we have a way of prioritizing access. Now these are ideas that have been floating and debates that have been going on for years. We've seen from Madam Director's report of CIK, we've seen through the Global Strategy and Action on Public Health Innovation and Intellectual Property. That was agreed to by member states. But there are still areas of work, and hence the need for this high-level panel. We need a right mix of policy option in this long walk that can help us not only improve access, but ensure that there is policy coherence between capital, intellectual property, as well as the rights of individual to access care. Thank you.
Thank you, Precious. And now over to Miranda Dujanish. She's the member of the Expert Advisory Group, Ohio Panel, and the Regional Coordinator of the Latin American Network for Access to Medicine. Miranda, over to you.
Thank you very much for what you have done and leaders in the work we are doing. First of all, I want to thank Secretary General for inviting me to be part of the Expert Advisory Group for the high-level panel. I'm very honored to be here this morning. As a woman living with HIV, I know myself very well what treatment means for life. I'm coming from Argentina, and I would like to highlight the situation, the particular situation of people in middle-income countries are facing. International efforts, including policies, funding, procurement, are leaving behind people in middle-income countries. Due to monopolies, generated by pharmaceutical actors. The life of millions of people around the world are threatened. Prices of essential medicines are out of reach of these people, and the establishment of the highly qualified teams a great expectation that should not be betrayed. It is very important to consider how a person feels when we wake up in the morning and the difference between having or not having a medication with you for your health or surviving. Communities expect countries to be actively supporting the work of the panel. The campaigns against the work of the dialogue panel are unacceptable and must be stopped immediately. I would like to refer only also why countries allow use to TRIPS flexibility. This is a very important issue because TRIPS flexibilities are really legal instruments that are in the TRIPS agreement. The countries have the right to use to protect public health. But what happens to countries like Argentina or Brazil that are using the main flexibility that is to define the criteria for patentability of pharmaceutical patents? We are now in Brazil and Argentina being sued, the government is being sued by pharmaceutical companies. In Argentina, for example, the patentability guidelines are being attacked for the judicial case by 26 pharmaceutical companies. Civil society organizations in both countries will have launched the Drop the Case campaign, the Pharma Drop the Case, because it is really that governments should be safe to use TRIPS flexibilities because we need essential medicines to be affordable. These measures that Argentina and Brazil are taking is to better administrate the vaccine system, to protect the system of abuses. And I will give an example of that is in a WHO report that analyzes specific hepatitis C medicines. And it was found that sofosbuvir is a key new GA medicine to treat hepatitis C. And the WHO found 21 patent applications on the same molecule. So this cannot be an abuse. Because this is monopolies, I mean it's exclusive rights and no shares can come to the market. We need really a substantial reform on the system, because the system is not really bringing real innovation. And we need the technology to be accessible for all, not only for few people in countries where they can pay for the medicines. Today, I stand in solidarity with activists from all over the world that will march for the rights of those colleagues and friends who couldn't be to see the conference coming back to Dubai. Because they do not access the medicines that they need to keep alive. Today we stand together for the right to health for all people, irrespective of where they live and what the disease they may have. Thank you.
Thank you, Lena. It's now my pleasure to open the floor for questions, members of the media. Any questions as a clarification or more substantive questions, we'll take a number of questions and then the panel will respond. Please. Stand, please, as well, just so we can see you.
Question actually about the law and because my understanding is that there's been quite a lot of pressure from the pharmaceutical companies behind the scenes during the discussions you've had about your report, which I believe is now in draft form. Are you able to say anything about that and whether you would resist pressure from the pharma industry? Please.
Thank you very much. My name is Ryan Anderson, from Savannah. My question is, there appears to be problems around intellectual property. What is the level of engagement with the, say, the ARIMO, the African Intellectual Property Organization, or the International Property Organization? What is their representation in such a meeting? I thank you.
Thank you. Shall we take a few more questions? Any other questions or comments?
My name is Helen Go for Cameroon Radio Television. Many middle income countries like my country, Cameroon, relies a lot on the global fund to fund its programs. My question is directed specifically to the United States General. What can you say, what should African countries do to support their programs more and not rely exclusively on external help?
Before we hand over to the panel, please ask.
Sean Wonder, Darcy from Canada. This is for the panel. How do you feel that the Trans-Pacific Partnership and new trade agreements will impact access to essential medicines, especially in the context of HIV/AIDS?
Thank you very much. I'm going to hand over to Madam Davis, the co-chair of the panel to respond to the questions. So the first one is very much about pressure behind the scenes and how the panel is coping with that. Another question about how intellectual property organizations at the regional and the global level, RIPO or WIPO, are involved in the work of the panel. A question about the Trans-Pacific Partnership, the trade agreement, and how we see how that might be affecting HIV. And there was one question over there that I would like, we'll come back to that for a clarification from the person who asked the question. Those three are teaching about.
I want to speak about pressure. We are so resistant to pressure that we do not feel that as possible also. But I can just say that we have representative of the pharmaceutical industry and the generic industry, the innovative and the generic industry in the panel, and they were real good members, and they wanted also to bring a result that is a result beyond the situation of today. So no pressure or no sensitiveness to pressure. The second question was on the participation on the other agencies who are responsible for IP or for trade. I can say perhaps this should be added also by Nandi Bandiwal, that in the expert advisory group, they were all represented and very active also, and we received from them many inputs that we took into the large range also, the 182 contribution we received from very different sides. As somebody in also I could witness also the common work that is established now between UKO, WIPO and WHO, and I think what we are trying to do, and what the Secretary General wants, is to bring the coherence in the international and among the international agencies and organizations stronger, and to have a real common coherent position, because when we are speaking about incoherences in the different law and legal systems, I think there is also incoherences or difficulties to have a common view between different agencies, and our panel has the duty to help to more coherence between also this agency and the associated to our work. Now on TPP, I mean, this is something, and I made some brief allusion to that in my short presentation. It is clear that from the time of TRIPS and Doha, there was a movement to fragilize these flexibilities in different free trade agreements,
and there can be the TPP, but it can be also regional agreements or even bilateral agreements where countries renounce to some flexibilities for other advantage. But in our view, clearly, this other advantage cannot be considered legitimate if they threaten the right of health or human rights.
We have one final question from give this question to you about what do we expect from African countries to be able to deliver treatment to their people?
It was more about funding as to how we can consider this. I can say that we've looked at innovative financing, for instance, that is based on airport tax. That was followed by the few countries led by Brazil, Norway, as well as other countries like Chile, France, and so on. I do not see why African countries may not follow the same approach of coming up with innovative financing mechanisms. Airport tax is one, but there are other floating ideas, for instance, with the red loan, which is based on the transaction tax arrangements where people use their credit cards and they can be for every cent that is collected, it can be put into a pre-fund. There are a whole lot of other innovative ideas using mobile technology transactions to get financing. And those are the kind of things that can be discussed in the continent. There are a lot of people using mobile phones now, and we can raise financing through those innovative ideas. But I just want to say that you see also with the civil society organization that have come up with ideas that also raise funds. NSF, for instance, fund most of their initiatives and activities, and I do not see the reason why this kind of approach cannot be followed. Thank you.
Thank you, Marsha. So I think we have to get ready. There's another press conference starting in here. On behalf of UNDP and UNAIDS, who is the Secretariat to the high-level panel, we would like to thank you very much for your interest and for coming out and asking questions. It's important to report what we have soon, and we'll be into the Secretary General very soon, so we hope that you keep your eye on this process. I'd like to thank the Secretary General for his leadership in establishing the panel. Thank you for being here with us today. Thank you as co-chair and members of the panel and members of the advisory group. Michelle, thank you very much for the leadership. And Honorable Minister, thank you. Thank you.